of you for coming. I appreciate it.
Those are fundraisers.
Secretary, how are you? Nice to see you again.
Nice to see you.
So I think we'll get started. There may be a few stragglers coming in, but I know the delegation has a tight schedule, so we'll just convene our session. I know a number of you, but for those of you who I haven't met, my name is Kathy Hackett. I provide family support through a contract through the Department of Developmental Services here at Community Services. And I have the pleasure of introducing our legislative delegation today. Here we have Seth Rollbein, who is the Senior Advisor in Senator Wolf's office, Senator Dan Wolf, Representative Tim Madden, and our Legislative Liaison, Nell Coogan. I really appreciate it and welcome our legislative delegation here today, and also welcome you. I think information is power, and it's really wonderful to be able to have an opportunity to exchange information, and hopefully people will leave here today with things that are helpful. So without further ado, I will turn things over to you, Art England.
Thanks, Kathy.
You're welcome. Thank you.
Let's start with a little quick story about Kathy. I've learned.
Uh-oh, that wasn't part of the point.
Should I talk about your husband as well? That's a little different side story. But I first heard Kathy Hackett's name probably about 8 or 10 years ago on Nantucket, when I was working with the same capacity that Nell does for the Vineyard. I was the liaison for Nantucket. And all of a sudden they got word that this Kathy Hackett, and she does stuff, and she lives over in the Vineyard or in Falmouth and blah, 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 and she works also with Nantucket. And I said, oh, great. In other words, we don't get anything. So the first thing I did was I called the social service agencies and talked to several different people and said, tell me about this Kathy Hackett. She's calling, she's looking for money and so forth, and why should we give this woman from the, from the mainland or the Vineyard any money? And they did nothing but rave. And that is so unusual, as we on the islands know, especially. Usually when people say Cape and Islands, they mean the Cape. No offense to anyone who lives on the Cape. But to me, I was even more parochial then by looking just after Nantucket's obligations, as Nell is so good at doing for the Vineyard. But now I really have a keen eye on making sure that the islands receive their just due as far as those budgets go. I also represent part of the Cape, so I often get invited to meetings where they rue the day they invited me because of that conviction. But Kathy her reputation is well deserved. She's done terrific. I've met with her a few times over on the island already. Many times I run into her on the boat. It's kind of interesting because I always have to remember where I'm going. But I'm going to the Vineyard. But with that, and
if you flew, you wouldn't have that problem.
And one thing I will, the little joke about Kathy is that Kathy's husband had a slight injury once when he was hunting on Nantucket, and it was just a little blib in the Nantucket paper. This was a few years back, and it's been resolved to a degree anyway. But anyway, thank you so much for having us. It's wonderful to be here. We really want to hear from you. We've done this in the past, and we'll continue to do it. It's great. Julia Burgess has done a great job, advocating as well. I jokingly call her the secretary, and she knows why. But anyway, with that, thank you all for coming out. We're looking forward to hear from you, and I know we can hopefully answer some of your questions. And by the way, you want to pass these around? Take one, pass it around. So with that, Senator.
Thank you, Tim. And at the outset, I want to say that Tim has been such a great partner on Beacon Hill and here in the district. For me as a fresh person in this job, to have had the leadership from Tim as far as informing me on the issues out on the islands here has been just critical. And you were really well represented by him on Beacon Hill. He's really a tireless advocate. So I want to thank you for everything that you've done.
Thank you.
Both for the district and for me as well. I think, well, let me just start by saying thank you to all of you. You are the fabric of the social and human service community here, and really to a large degree, I think the work that you do defines what makes this such a special and wonderful community. So I want to thank you and thank everybody who is here, and even those who aren't here. Two of sort of the misconceptions or understandings that we need to make sure that we are clear with in Beacon Hill as we advocate for this community. One is that it's not all rich folk, and it's almost, as I've gotten to know this community better, it's almost the opposite, that need as defined by the gap between what people need and what they can afford. This place is in some ways as desperate as any place in the Commonwealth. And that is a preconception that we need to continually deal with on Beacon Hill as we look for resources to do the good work that everyone's doing. The other thing is that I think the isolation of these islands is misunderstood, because it seems like if you're coming here on vacation, it's so easy to get here and it is so connected to the mainland. A lot of that is because that gap is filled easily by those with the resource and ability to fill it, and that is money. It's easy to get to and from, and the transportation is easy if you're a gazillionaire and you don't really notice the transportation cost. If you're a person here in need, if you're a person here looking for an education, the cost of getting to and from, both in time and money, makes it prohibitive. And it's one of the reasons that we have to make sure that the services that so many of you provide, even though from Beacon Hill, from that perspective, it looks like it's dollars that are not being spent as well as they might be in other locations of the state, it's critical. Because to get those services to and from, or to get people who are in need to and from the services, is much more challenging when we're dealing with this community. So, Tim certainly understands that and is an advocate, as am I. I'm going to make my big picture pitch a little bit, which is not popular, but I am a Democrat, and I think this is part of what the Democratic Party needs to be talking about. It's not universally agreed on in the party, but I will talk about it. We seem to be stuck on simply having an annual discussion about what we cut. And a few years ago, when this started, 2008, 2009, before I was elected to office, remember, we were already cut to the bone, we can't cut more and more. Well, that means that for the last 3 years, we've cut into the bone relative to the services, relative to vital infrastructure investments, which really are long-term investments, relative to education. And I think the most vulnerable, both in terms of the population that we're talking about, but in terms of cutting, because very often it seems like soft dollars is human and social service programs. And I am really concerned about that. And that is the spend or the cost side. And we need to start having a conversation about the revenue side. And that needs to start here. It does need to start here, because I will tell you that the difference between political leadership and political followership, or the difference between, as I say, a public servant who is a servant leader versus a public servant who is a servant follower, this is my pitch, is that a servant leader listens to the need in the community, both from individuals and from the community in general, and synthesizes what they hear from that need, and then with that creates a collaborative or a collective vision or sets of vision, and then synthesizes that into actual action. And what that means is hearing, listening, learning, synthesizing, visioning, and doing. What a servant follower does, and this is a very important thing that I'm learning up there, is listens to people and then simply says back what they think needs to be said in order to get a vote or in order to be popular. And the problem with that is, in a culture like we live in that is dominated by the Fox televisions of the world and the Rupert Murdoch media, is that it's very easy to listen to people and then play back anti-government rhetoric, anti-tax rhetoric, let's continue to dismantle government rhetoric. And if we do that to our disservice. So it's very important. What I hear when I listen to input from those who are watching our infrastructure or our human and social service needs is I hear we need more resources. I don't hear what we need is to cut more. And yet I hear from too many of my colleagues, even Democrats, that what we need to do is balance the budget by cutting more. And there's a disconnect. When education is too expensive for people, when we're not investing in the future for our children and grandchildren, when we are taking money out of social and human service programs, those are all needs that we need to meet. And we have an economy that has totally restructured itself in the last 30 years in this country. And we are not raising revenue in a way that is consistent with the way our economy is structured today. So if we want to get real about how the economy is structured and then how we raise revenue in the context of that, we really need to look in fair, equitable, and visionary ways going forward. We spent the last generation borrowing from the future. Now we need to spend the next generation investing in the future. And that requires that people really make their voices heard, that we cannot continue to expect Massachusetts to be a leader in education, in infrastructure, in environmental protection, in entrepreneurship, and in research, when we're 32nd as far as revenue. And that's where we are. In the mid-1970s, Massachusetts, when it got the name Taxachusetts, was number 2 as far as state revenue or state collection on a per capita basis. Massachusetts is now 32nd in the country. And I actually did a little thing with my kids at the table last night at dinner. I said, how many states are there between Alabama and Massachusetts? Can you all figure that one out? I think there's Tennessee, there's Kentucky, there's Ohio, and I think you got to go through New York, and then you get to Massachusetts. That's a lot closer than you might think. Did I miss a state?
Pennsylvania. You have that little corner. Erie.
Pennsylvania.
You don't need to do Pennsylvania, because, yeah, you can jump right from Ohio across the Great Lakes.
With the flying.
Sorry, David.
But
I thought you had to go through Erie.
so I will shorten it because we only have about 45 minutes and we do want to hear from you. But this is an urge to say, it's not this can't be a race to the bottom. This can't be a race to the bottom. It's got to be a race to the top, which means we need your help and your voices heard as far as addressing both sides of the budget. So that having been said, Tim, you might want to talk a little bit about the budget process and where we are on that.
Well, the governor's done his budget, which is House 1. We like to, some of my friends say they put it in a recycle bin. It usually ends up in the trash. Really what it is a template, kind of give us some guidance and some insight into where his thought process is as far as where the money should be expended. In my opinion, and it surprises me, and you talk about being a Democrat, which I'm a Democrat as well, we actually have a Democratic leadership in both the House, the Senate, and the executive office. In the executive office, with all due respect to the governor, and he's been a good friend to this island and a good friend to both of us, he doesn't seem to get it as far as I'm concerned when it comes to social service agencies. And with that, we have to remind him on the House side, and the Senate always does a good job following suit, sometimes even more strongly, to remind him that that's our #1 priority. Government has to do a lot of things, but most importantly, they have to help the citizenry who needs help. So with that, I think his budget came in, as it usually does, on the short side of social service agencies. And we will be putting in the House, I'm fairly comfortable, increases back in there, and I believe that the Senate will follow suit. Traditionally what will happen is the last week in April, the House will do its budget. Shortly after that, the Senate will do theirs. They're completely unilateral decisions made amongst each body. Then what will happen is the House and Senate will create what they call a conference committee, and they'll work out the difference between the House budget and the Senate budget. Once again, remember that budget 1, House 1, is already still in that recycle bin. So we're dealing still with those two budgets. That's the budget that those conference committee comes up with that will go to the governor's desk for signature. What he traditionally does is look at it and he goes, maybe he's learned some things, maybe he realizes that maybe he had made some mistakes and saw the wisdom of the House and the Senate. Sometimes he thinks I'm still right and he will make his corrections and go back to his original budget or even compromise a little. And then at that point it comes back to the House and to the Senate, House first then Senate for up and down votes on that or to override his vetoes. Traditionally we have overridden several of his vetoes. Not as many as in years past because of the tight budget, but we have overridden his vetoes and put the money back in, and usually the Senate has concurred, and then we have our final budget, which we will hope to have by the end of July, and that's what we'll have to live with in the next fiscal year. It doesn't look good, and once again, it's like a broken record here. I actually thought we were beginning to see a little bit of light at the end of the tunnel. But what's happening with the federal government now really has kind of extended that tunnel. So the light was there, the tunnel just got longer. How long that tunnel is going to be now, we really don't know until the feds work it out. I have to admit, I'm very concerned with that. My sense is that after we have an election, then the gloves will be off, and we will actually finally get some work done out of DC. And I'm afraid that it's going to be devastating for a lot of us. But with that, you know, the House and the Senate have done a good job in restoring the rainy day fund, as we call it. It's back to over $1 billion. And I think we did that even though some agencies were asking for some of the monies as the revenues were coming in strongly. But in the last couple of months, we've actually seen that the revenues haven't met their expectations. So it's a good thing we do have those revenues there. There again, if the federal government cuts more than what we were, we would like, which would be nothing, but so we can count on that, then we do have some backup funds. But really, this is a recovery that's taken a long time, and many of us, and you especially in this room, know it probably more so than others. For some people, it hasn't been a recovery at all. So with that, I think you have strong advocates in both of us. Matter of fact, I know you do. The difference for us, I think, will be prioritizing where those monies are spent. My belief is the executive office has gotten to the point where they feel as if they know best where our dollars are spent. As I said earlier, and I don't mean to repeat myself, but I'm fairly parochial, and I think the local people know best how their money should be spent, whether you're talking about community colleges, but especially when you're talking about social services agencies. So as much as I'm for the idea of regionalizing and saving money and working together collaboratively to remove waste, there again, decisions have to be made by the local people who know their communities best and what their true needs are. They're the best watchdogs, and they're also the most concerned. So with that, it is going to be a battle. We've both put in our budget recommendations. Always first and foremost on my list is social service agencies. And I truly believe that that's what government needs to do. We've also put in, and I'm sure the Senate's office will follow suit as they have in the past, some language in there that allows for them to take into consideration the cost of services and transportation to the islands. The governor, you know, that used to be in there. He had taken it out. We've been able to get it back into the budget over the last, since I've been up here, and hopefully we'll get it back in. The Ways and Means Chairman, who's new this year, seemed to understand that and was happy to hear that it was working and it was beneficial. And that's our understanding. We don't want to just put language in there and find out that it really doesn't help the district. We need to know that it helps the district. And so with that, we got feedback, and apparently it is having some benefit, and those are the type things that we'll advocate for, is just to make sure that we can get the dollars here. And that's, you know, we're going to hear from you. It's easier said than done, but I believe the squeaky wheel, and we push and we advocate. So with that, like I said, this community has been terrific. The Impossible Dreams auction is something that really is not only a fun event, it's a beneficial event. So thanks, and we'll go from there.
It would be great as we did the Q&A. I would love to hear from people as they talk about their organizations. If they compare budgets prior to, by whatever metric you want to use, prior to this recession, prior to 2008 or in 2008, to where they are now, because one of the things that concerns me is this whole new normal discussion, that everybody says, well, we're level funded. And you know, my issue is level funded compared to what? Because if we're looking at level funded 3 years into a recession, that's not victory, that's just continued triage. So, you know, I'd love for people to be thinking in 5-year periods now, if we're gonna get things back to, you know, sort of the healthy investment and sustaining instead of continuing to borrow and cut. What does that actually mean in this context?
And I just want to jump in before we jump into questions here. Just so you all know, I mean, I know this is a great opportunity to ask questions, but it's also one of those times where if we don't have the exact answer to your question, please follow up with me or through Kathy, whichever way, and we'll get you the exact answers. Because we want to make sure we get you all the answers we can, and sometimes we're as prepared as we can be, but not always perfectly. So we'll get back to you, okay?
I'll jump in, and I'll follow up. David Nathan's from Martha's Vineyard Museum, so not as directly involved in community or health services, but we see ourselves as part of the educational services factor. But Tim talked about the auction, community services does. I was in Washington last week with the American Association of Museums seeing congressmen and senators at the federal level. And we talked a little bit about the sort of silent elephant in the room, just charitable contributions. And what impact and what can we do, what can you do to help us who are in the nonprofit service industry with this whole tax policy, because charitable contributions would, I know at least in terms of our organization, I would guess that probably 60% to 70% of the revenue on an annual operating basis are done at the level that would be impacted by what they're talking about in terms of charitable contributions.
Right.
Substantial, especially for educational and cultural organizations, and I think impacted in community services as well.
I'd be curious to hear what the feedback was from DC, because when I saw that, my initial reaction was, that's great, campaign ready to talk about, but I really just can't see that happening. But with that being said, I'm not in the federal government. We'd be curious as to what your feedback would be.
We were talking mostly to aides, but in a couple of cases we actually did see a few of the reps. We didn't get to see Keating directly, but we talked to an aide. We did get to see some people from Western Massachusetts, Rich O'Neill and Rich O'Neill, who's a pretty senior level. They think that it probably isn't going to happen the way it's being suggested, but I think at least he directly suggested that something's got to happen in tax policy, and there's got to be some give in terms of the revenue side.
Right. I think I have a couple of side thoughts to that maybe I can come back to. I think you wanted to jump in and make some comments, but why don't you go ahead and do that, and I'll come back with a couple of things that I will throw out, being the kind of person, the wet rag in the room sometimes, but go ahead.
No, I think probably after my opening comments, nothing I say for the rest of the day will come as a surprise to you. It's completely bizarre that we're talking about attacking the one tax incentive that all of us would agree actually incentivizes the right behavior. I mean, how weird, I said this earlier today, I feel like I went to sleep in Bedford Falls and I woke up in Potterville. I just, sometimes the mind boggles. So we need to look at tax policy. We need to look at it in the context of, a generation ago, the top 5% owned around 30% of the property and equity in the United States, and now the top 5% owns over 70%. We need to look at the fact that capital gains, which is, we figured out crafty ways to make capital gains income, which really is income, taxed at less than half the rate as other income. And then we need to re-energize the belief that government, through some of those tax policies, but also it's not just about encouraging philanthropy. It's about investing in history and in museums and in education. Investing through government in those things. Because we can't just think that incentivizing the right behavior and then all the money is going to go to where it needs to go. So I would say two things. I think the chances of the charitable contribution portion of the tax code changing is zero. I cannot imagine that. But it's still a distraction from what we should be talking about. So this is the way, I hate to say we and they, this is the way some people think that you play this game. Is if you put out these bizarre recommendations and then get everybody to discuss that, i.e. let's not have contraception available, then you keep the eye off what the real ball is right now. And the real ball right now is what's happened in the last generation relative to our ability to invest in our future in any way you want to define that investment. So that's my long-winded answer. I don't see that as a real threat. I hope that's what you heard down there.
Yes, but the attack on the wealth was a part of what that political rhetoric is. And I hope you're right. I hope the political rhetoric goes away, that there's some sense brought.
Because I think there still seems to be some, at least in reading the articles that I get on the internet, on email, they're still talking about places like universities, hospitals, the larger museums and so on, people who give like $10 million to it as a contribution, or $50 million. there's gonna be some way of still trying to diminish the amount of,
Well, and
deduction one can take, but that's,
and the other thing that I've been hearing, not so much in Washington, but in then trips down to Florida to talk to patrons about planned giving, 3-year, 5-year commitments. Some of the feedback I'm getting is, gee, if they figure out what's going on charitable contributions, I might be able to commit that, but if I don't know what's going on there. So just that rhetoric is holding back. I don't know if other people are having feedback on planned contributions where you're looking at things out 3-4 years, and so that it's impacting us right away. I mean, it's impacting today.
I'd like to ask a question
Yes.
that's off of though the federal, but the charitable contribution. And my question is more to do with, we have, of course, a number of programs that have been quote-unquote level funded, some to the point of like maybe 14. I think Daybreak, the clubhouses, were level funded for about 14 years or something. But I'm actually also looking at, and speaking to what you were talking about, Representative Madden, about the
You can call me Tim.
Tim, I know, it's all been televised and all that, so I thought I'd ratchet it up some. But that things are being, that the executive branch is basically kind of really trying to take over.
Yeah.
And I'm thinking not so much even about the amount of money, but how they're reorganizing in reorganizing all the state departments in response to level funded or budget cuts and so on. And how it really does hurt the islands. For example, Department of Mental Health, maybe 4 years ago, would have had maybe 20 different
Line items and stuff.
sites,
Yeah.
you know, or sites around the state to distribute money, and we would get our grants directly. Within another year, they're going to have it down to maybe we'll give out maybe 5 grants, and we'll have to figure out how we can subcontract from a larger organization that might be $100 million organization. And then it's like begging for crumbs as they figured out how expensive it is to provide the services here. And that's already happened with one of the grants that they've given, so we get the services just really became much smaller as a result. And I think that if there's any way that the legislature can have some impact on how the various state departments are organized, so that money can come here directly rather than through the larger not-for-profits. And that's not just, say, for mental health, but throughout, there's a whole range of the various departments, whether it's DMR or,
But they are going to
yes,
come
go
back.
down the acronyms, but, you know.
Tim, do you want to add?
Couple of thoughts. One, I agree, and I agree with what you said as far as the charitable giving as well. I mean, it is ludicrous, but like I said, we'll go back to that in a little bit. The other thing they're doing, and to me it's very similar, they're putting in the idea of regionalization. We could look at Taunton Hospital, and now they want to close that and have everyone go to Worcester because they built a new facility in Worcester. Well, that's great and fine if you live in Worcester. And Taunton's far enough away. You know, so that, to us it's just an additional journey put on the caregivers and the family members who should have closer access to. Just like when we were talking about some of the jails closing and so forth. Not that we want to see prisoners living on the island. Bottom line is a lot of those people that are there are their families here, and that's the best way to get those people on the road to recovery, is having family members around there to remind them why they need to recover. So the further you take that away from the family, the less effective it is. The other thing that I noticed with this idea of consolidating line items in the budget, to me, we're supposed to be talking about transparency here. It's not being someone who sits there and believes in line items, because I believe in line items, because I want to know where that money's being spent. You know, why shouldn't we know where that dollar's going? How do we know whether or not it's being spent the best way that we think taxpayers' money should be spent and best for our district? You know, the taxes start and all that budget process starts in the legislature. We have a responsibility to monitor it and see how that money's spent. So with that, the idea of, what do they call it? when they put their little own pet peeves or, you know, what they call them?
Earmark.
Earmarks, yeah. I love earmarks. You know, if we didn't have earmarks to bring money back to the Vineyard, the money wouldn't get back to the Vineyard. So if we can earmark stuff and say specifically where that money is being spent and how it's going to be spent, I'm willing to fight for it up in Boston to get it. And I'm willing to make sure the agency that gets the money, I don't end up with egg on my face after they got it. And there's some agencies out there that have gotten some money that have some egg on their face. And if we had known they existed, maybe we would have looked at it more carefully and said, well, how are they spending the money? I'm willing to fight for any agency here that proves that it's doing well with its money and spending its money wisely. And fortunately, we haven't gotten into the past that some of the areas have. We have the collaboratives that we just dealt with. Why? Because there are agencies out there that have misappropriated their funds. They've spent their money poorly, and there haven't been the watchdogs there. So with that, you know, I think the key to me is the transparency. And the more layers you have of the bureaucracy to filter out that money, once again, it goes back to, you know, what I said, and I think you're agreeing, Julia, is that we know best how to spend the money. Give us the money. It's no different than the governor's argument that he took to Obama when we were talking about the stimulus money. He went there with a group of governors and lobbied President Obama to allow him as the governor and the executive office to decide how the best to spend that money at the state level. Let us decide where the road money is going to be spent. Let us decide. Great idea. I agree with him completely. But that goes down to the parochial level as well. Now give us the money. Let us decide how best to spend it in our communities. So with that, I think you bring up a good point. And I would just encourage you, because you're out there a lot, you're mixing it up with the big boys, and sit there and tell them, hey, wait a minute, I don't go for that. I want the money to come to the Vineyard, and I want to help determine where the needs are, and let us spend the money. So.
Are earmarks going to come back?
No, you know, they're told they're not. I still throw them out there, and I'll still do budget amendments when it's appropriate. I don't like legislating through the budget. You know, it's not that if it's my idea, I might do it. But basically, earmarks in a budget where you're talking about specific funds being allocated, I'm not opposed to that, and we'll continue to do it. It's a budget.
Yeah, I mean, maybe we should call it something else. Tim is exactly right. It's what has happened, you know, in an effort for transparency to get rid of earmarks, and they are gone, is we sit there trying to fund your programs. What it's actually done is driven the whole process underground. Because now what we're forced to do is advocate for funds to go into departments, and then try to go directly to those departments and get carve-outs in their budget to direct the money here, which actually makes it less visible to the public. Because those are discussions that are not being held publicly. And you know, we're doing that because we're forced to do it. It would be much nicer if we could go in and say, let's do it through an open budget process, and let's literally direct money, because as Tim said, I totally agree. We understand, because of meetings like this, where you need the money to go. And it's a big state. Now what we're forced to do is deal directly with departments who don't have the tentacles as we do into the communities. This is a great system. I mean, Tim has a better grasp on the communities that he represents. At my level, because I represent a bigger area, it's there, but it's not as good, but Tim can feed me the information. I have 6 reps that are coming to me. I can advocate on the Senate side. We can coordinate what we do through the budget. When we had the ability to use earmarks, that was actually a vehicle that we could collaborate on. Now we don't have that collaborative ability. So yeah, I mean, let's call them something else, but I think we need to be able to drive that level of granularity through the budget process, which we don't have right now.
Just to piggyback on that a little bit, and this is where you guys need to let us know. Kathy, you called us recently about, you know, visits that we're going to discontinue. We were able to advocate, and they've committed to come back. They wanted us to go, I believe, was it Canton that they wanted us to go to, or
Carver.
Carver. I knew it was a
You're
C.
thinking of the hockey team.
Right, exactly. Don't I wish? But anyway, you know, it was a situation where they decided they no longer had the funds to provide the services on island. So the idea that we were going to go to Canton for a hockey game first, and then continue on to Carver for these services was just unacceptable. And luckily, because Kathy brought it to our attention, we were able to advocate to have those services come back to the island. We were able to reach an agreement. Okay, fine, we don't have to do it every month. We don't have to do it every week. But if we can do it X number of times, it'll service our needs. And they've agreed to do that. Now, it's probably a battle that we'll have to have time and time again. But if we don't know about it, if we find out 2 years later, it's hard for us to advocate. It's better to stop it before it happens than try to correct it after it's happened. So, and I'm sorry, go ahead.
That's okay. My name is Jonathan Burke. I'm a member of the Daybreak Clubhouse. Thank you for coming this morning. I just wanted to sort of echo what you were saying, Senator Wolf. There are over 8,000 Clubhouse members in the state. And my bet is, I mean, I haven't talked to everyone, but my bet is that all those people would support your drive for more revenue over less cutting. We've been flat funded for 12 years. We've had to fight the fight every year for the last 5 years because not only have we been flat funded, but the scalpel always comes towards us. So I just wanted to sort of reaffirm that is, I think, a great message that needs to be brought to everybody.
Well, when I articulate this, and maybe I'm only talking to audiences where it's a friendly discussion, but I try to have this discussion with everybody, regardless of party affiliation and regardless of whether they're in the top 1% or the bottom 99%. I find very few people who disagree with it. I find very few people who say, you know what we need more of in this country is we need more wealth to concentrate at the top. I just don't, I'm not hearing that a lot. You know, the analogy I use, you know, the rising tide raises all boats. You know what's happened in the last 30 years is the rising tide sort of happened, and the tide's been going out, and the people with the yachts, they all positioned the yachts over the channels of the deep water. So everybody else is sort of left on the sand, and they're like walking across the sand, and they're yelling to the guys on the yachts, hey, can I have a job? I mean, that's just not, that wasn't the way this is supposed to work. So, you know, we gotta have the conversation in a way that doesn't scare people. And I think there's so much fear out there. They're trying to take away what we have left. It's a conversation, it has to be messaged right. And I don't mean that in a Park Avenue way. I mean that just having an honest discussion about what we want this all to look like. This isn't what we wanted. It's not what we signed up for.
Right.
And I think, you know, we can have that discussion in a mature adult way. And we gotta take some of the consultants and ask them to wait outside, so when we're done having the conversation, we can report out to them. Because a lot of what goes on in politics right now is being driven by people who are simply interested in taking the temperature, but they're not interested in changing what the temperature is. So they're simply reading the thermometer and telling us what's out there. That's not what we need right now.
Right. We think we're a program that works. And we have all the evidence to support it. So it's just mind-boggling that they keep coming to us, like you said, you know, trying to cut away the bone.
The clubhouses are one of the best examples of a program that works. I mean, I've been to this one, been to ones on the Cape, talked to other colleagues who have clubhouses in their district. It's a wonderful program.
Something my wife rarely says, you think right. Yeah. Clubhouses are wonderful, and they have been cut disproportionately. We can have the philosophical discussion about the 1%, and trust me, I'm not in that 1%. I have maybe some people who live around me on the island that are in that 1%. Many of them have been very generous and would be willing to pay more. That's a discussion that will probably happen at the federal level. We can do some things locally. But what troubles me about the cuts in the budget is where they have been placed. There are budgets that actually have increased slightly. There are budgets that have been cut 2%, 5%. And yet we have our social service agencies that are cut roughly at about 45%. And that's not right. You know, if it was a fair budget before and we had 10% less revenue, I hate to be this simplistic, and I'm not, you know, I wasn't born yesterday, but if, as a starting point, cut everyone's budget 10%. Not some getting increases or hidden increases and others taking hits and actually taking double hits. So with that, I hear you. I'd like to tell you we're going to make it better. We had the discussion at the clubhouse earlier, and Dan and I had the pleasure of going there. What a great community service that is. These are our people. These are our family members. These are our relatives. These are people from our community. And if you don't have clubhouses, you have those who have a need, and we're abandoning them, and that's wrong. And it's not beneficial to us as a community to have individuals like that without that attention. So it's a wonderful organization. I appreciate all the support it gets, and I think we came away with some good ideas of maybe how we can help you. So, and we're going to advocate for that.
But by the way, just to get back to the budget for a second, the real elephant in the room there is medical cost. It really is, and one of the things we do need to really look at cutting cost is health care, and we are going to. The Senate has been working on a bill. It's probably going to be out within the next 2 months. That is really going to, take the governor's bill, which he put out, I think, 8 months ago, and really look at ways to achieve some savings in healthcare. Because if you look at our state budget now, so much of that money, which did go to other programs, is now just being gobbled up in healthcare. Which, hey, if we all agreed that it was providing a longer and better quality of life for everybody, and it's worth the investment. But again, if you look at the trends versus other, quote, wealthy countries, we are spending much more money and getting much less for it than other places in the world. So I think there's some great ideas that are coming up as we have that discussion. That's a committee that I serve on, the Healthcare Finance Committee. And we're having, I think, some really interesting discussions as far as breaking the back of fee-for-service, looking at better managed healthcare, not managed by administrators and HMOs, but actually managed by providers and clients. What a concept, that will have better outcomes for less money. So, that is one area where I think we're going to have some success in the next couple of years.
Yeah, and I believe that bill will be done. Both branches have committed to it. With that, as those bills progress, it is going to be very important for people like Sarah Koo to look at them and see where there's a fly in the ointment, so to speak. The New York Times had a nice piece on medical records a couple of days ago. And it was supposed to be the second coming of saving money and efficiency. Well, it's turned out that that's not really the way it's working. It's actually driving up the cost, it's creating more work. And, so as we do things oftentimes with good intentions, we've got to make sure that the collateral damage isn't something that we decide to live with. We need to be able to correct it, and once again, if we can correct it proactively rather than after the fact would be better. And Sarah, you had your hand up, but it's a good segue into you because you live it every day.
Well, yeah, I don't think anybody would question your point that the cost of medical care. I was in a meeting a few weeks ago with a bunch of representatives from Mass Health and Commonwealth Care. And they're talking about the Mass Health budget, and the budget is something like, I don't know, you know better than I do, 25% or 30% of the entire state budget. And of course, I'm trying to advocate for what we do, which is the access, outreach, enrollment, and retention services and connecting the dots for the members so that they can use the billions of dollars worth of benefits, which we wish was less, so it was more cost effective and more of an emphasis on prevention and all of that, definitely we agree on. But I sit there a little bit flabbergasted that this very small program that we're trying to see put back into the budget of $2.5 million statewide for the Mass Health Outreach and Enrollment Grants, that the leadership at Mass Health is not, can't see fit to fit that into. It's just got to be a tiny fraction of that multi-billion-dollar budget of theirs. So, I would hope that in terms of looking forward to FY13 budget, that you can both support the restoration of that grant program. It's a statewide, it's 50 agencies or so. So for us, it doesn't make or break us necessarily, because it's not like we can fund our entire program with $40,000 of the grant from the state, but every little bit helps. And our budget is in fact probably like most of the organizations here cobbled together from multiple different funding sources and grants. And it does make sense to us, since a lot of what we do is help people navigate state benefits, not just access, but navigate, and the retention is a huge piece, as you know, because so many people lose their benefits even when they remain eligible for bureaucratic reasons. They get kicked off, and then it can take months and months for people to get back on, and so on and so forth. So that's one piece. The oral health piece, as a lot of people in the room know here, there's also an essential piece, and it's sort of scandalous not to have dental benefits for poor adults. you know, just is shocking, really, to think in this country that there are people that can't get basic dental care through Mass Health or Medicaid when they should be able to. And talk about an ounce of prevention. I mean, oral health is certainly a classic example of where if you give people regular primary care for their teeth, they're gonna be able to, you know, save a lot of money. They'll end up in the ER if they don't get it. So there's no cost savings. If people are
How
really
is it that the one organ that everything enters our body through is the one thing that's not covered by healthcare? It's, again, I mean, who came up with that idea? It's crazy. The other thing, I will pitch for it here, we need to stop having healthcare be connected to where you work. Now, you know, I say that as somebody who's been the CEO of a company that went from 6 people to 1,000 and always provided healthcare. I also say that as somebody who has served for 15 years on one of the larger chambers of commerce in the Commonwealth and was the chair of the chamber. That the largest problem right now in entrepreneurship and small business growth is healthcare. And yet you can't get the business community united behind the idea of this is just a bad model. I understand why we use that model, and I'm proud that Massachusetts, we do cover most of the people in the Commonwealth. It's still a model that over time we need to evolve away from. And dental care needs to be wrapped into it. It shouldn't be like an extra fringe benefit of a rich plan that has health care for oral, so.
Well, and it isn't, you know, because it's seamless. If you have somebody with an abscess and they don't have coverage and they end up in the ER, it becomes a medical problem. And we see that. And the other thing I would just say is that in terms of state services on the island, we do not have an office, the DTA on the island. And there is no designated surrogate, and so our program has become an undesignated surrogate for DTA on the island. So for food stamps and the Department of Transitional Assistance for food stamps and cash assistance, emergency assistance. You know, the person who falls off the roof and then they can't work the next day, who thought they, you know, still has their mortgage to pay and so on and so forth. It's the only type of direct assistance for people. And so, you know, whereas you might be able to drive to wherever, Fall River, Hyannis, Taunton, if you're anywhere but here, when you're on the island, it's not a realistic expectation that people who need those services are going to be able to get in their car and drive to one of those offices. Unemployment similarly. So it's just a huge challenge.
My name is Grace Sullivan. I'm a nurse practitioner, currently in a little bit of practice, retired, but only semi. A refugee from 30 years of teaching in the public higher education system in the state of Massachusetts. And I sought refuge teaching nurse practitioners and graduate programs in the state of New Hampshire. I taught health policy. First time I stood in front of graduate school and graduate students in New Hampshire, I said to them, before we start here, let's get some definitions clear. Do we all know what we mean when we say the welfare state? And 10 hands went up in the class, and I asked what it was, and they said, Massachusetts. So, as bad as you're saying things are here, they're worse elsewhere.
Yes.
On the issue of the balance between revenue and spending, I think a 6th grade child looking at what we went through last summer with deficits and spending is going to see that both have got to be addressed. But you're talking about the 800-pound gorilla in the room, and you talk about tax reform at the highest level, abstract tax reform as redistribution of wealth, as a way to fund our government, as a way to present the welfare state. That's years down the road. 20 years of public education might result in meaningful tax reform at the federal level. Healthcare reform is evolving. But what I'm concerned about is the loss of attention on long-term benefits for the sake of short-term. If electronic medical records and e-prescribing will cut down on errors, cut down on duplication, improve efficiency, improve communication, and improve health outcomes, then a small study that shows that at one place it cost a lot of money in the first 3 years to train everybody to use it is not going to mean a great deal. You know, Pasteur had 600 bottles on the shelf, and they said, what is that? He said, that's my failed attempt at curing syphilis. He said, don't you feel bad having such a failure? He says, now I know 600 things that definitely don't work. We're definitely gonna go in that route. But there's a 606. Maybe 20 years from now, my grandchildren may benefit from tax reform, healthcare reform, and the kind of state where no child does have poor teeth and poor dental care. And we do have a single-payer system. But teaching the public, we're moving backwards in many states, backwards.
Could I respond to that? I had the benefit of being with Deval Patrick last night. We did an event in Brewster together, and he is as inspirational as ever. And I agree with the governor. I totally agree with what you just said. This is a generational issue.
Yeah.
This is not going to be solved in Tim's term or my term. What we need to be doing now is changing a trajectory. We need to be saying, if we are just fortunate enough to connect two dots, and the dots are tilting us in the right direction, because the dialogue has been happening over the last 30 years about the welfare state, and that's how we lost the last 30 years. Is somebody was smart enough 30 years ago to say, let's make this a 30-year plan. And guess what? They did it. Now we got to make it a 30-year plan. It is totally about an investment in the future. I always say, if you want to see a time, the closest thing we have to a time machine is how we're educating our kids today. Because that is a time machine to what this place will look like in 30 years. It's the best time machine we have. Infrastructure, the same thing. Research, the same thing. Those things that invest in our future. But I totally agree, there isn't a 2 or a 3 year fix. It's both sides of the ledger, it's expense and revenue, but it's generational at this point. Because things have gotten to the point where this cannot be fixed in 1 or 2 terms. That's why it's so important, and again, this isn't a partisan meeting, so I'm not going to take it there. It's so important that you listen to people that we're electing and ask yourself, are they really speaking to future generations, or are they speaking to this generation? How much more can we wring out of the future to pay for today? Because the last 30 years has been about wringing out of the future to pay for today. The time has come to start paying today for what we want to see tomorrow. It is a complete philosophical switch. And there are a lot of people, you know, we're brothers on this. There are a lot of people who really do get this and who are interested in affecting generations to come, not just fixing next year's problem, but we have to all get behind this. We really and truly do. I cannot make that point emphatically enough.
And just going back to
For one more question, just so we know.
And just going back to the electronic records, that is something that is the future. That's where we're all going to be.
Absolutely.
But the idea that we sell it under the idea that it's going to save money,
Not now.
it should be, but it should never be about just saving money. It should be about the quality of the care that someone's going to receive. It's going to prevent those duplication of issues that shouldn't have been happening. It'll be the cross-referencing that will allow for better health care. Unfortunately, they couch it on the idea of saving money.
Yeah. Well, that's what gets listened to.
Well,
In education and.
I think right. I think the way I agree, and I think what we have to save money is as much as we have to look at the disproportionate wealth, we also have to look at ourselves in the mirror about what we're requesting from our health care. I think all of us have our own responsibilities as well. We have to demand more of ourselves, and I'm a sitting example as I sit here and eat my cookie. Yeah, he doesn't eat his, I eat his. Can you tell? But with that being said, we have a personal responsibility, and we should adhere to it. The other thing is we should demand more of our organizations. We have insurance companies that are making a lot of money. When all of a sudden Bank of America decided to go up on a fee for your debit cards, all of a sudden that went viral and it got corrected. That's the power of social media. Now, if the same thing had happened when the gentleman from Blue Cross Blue Shield walked out of a job he really cared about with a failing record with a $15 million parachute in a non-profit organization, something's wrong with that as well. And that's where we all have a responsibility. You know how far the possible dreams money goes and what good agencies it serves. But some people have lost sight of that. We have to also make sure that we're watching to see how our dollars are spent and our nonprofit dollars. That's an embarrassment to have that happen. So with that, I won't harp on it. I know we have limited time and we have one more question.
I'm here actually to thank you for something that I believe you both have done, and that is to sign on to the Senate Bill 772, which is designed to reverse the horrendous catastrophe of the Citizens United versus FEC ruling.
Could you believe there ever had to be such a resolution? I mean, to me, it's unfathomable that we have
But
such
I
a...
guess that's gonna be another long fought battle.
So
There's gotta be a resolution in the Constitution.
I actually call it Citizens Disenfranchised, not Citizens United, because that's what it is. But we penned an article that's gonna come out next week in the paper where I encourage the Supreme Court justices. I started a company 24 years ago, and it so happens I have a daughter who's 24, and a daughter who's 22, and a daughter who's 18. And in this article, I invite the Supreme Court justices to come visit me so that they can see the difference between a corporation and my 3 daughters. Because I have to tell you, I mean, I love Cape Air. It's a great company. But, you know, I didn't bring the bottle to work and try to feed Cape Air. And, you know, we gotta have a sense of humor, but it is so stupid that on so many different levels that we give the rights to corporations to advocate and speak freely when we know they exist for one reason. And that's to enhance shareholder value and make a profit. That's not a dirty word. That's how our economy works. But to give entities who exist for that purpose the same rights as human beings who exist for a panoply of purposes, soul, spirit, inspiration, energy, love, all of those things that make us human, and we put on the same platform an entity that just exists to make money, where have we gone? I mean,
Even Montana's opposed to it.
Even Montana.
Well, the circle closes.
I want to say one other thing, because I would be remiss if I didn't have the political bully pulpit and say this. Women's rights in this country are under attack.
Thank you.
And I'm going to say this as a father of 3 daughters and as the husband of a woman who wants me to sleep in the other room. Okay? This is outrageous. It is time for us to start circling around issues and just say it ain't going to happen. I mean, I'm marching tomorrow in a parade, and I hear rumor that Scott Brown is coming. I hope, if I have the time, to get enough out there to organize some folks to come march with him and say, this guy just voted on the Blunt Amendment, which is an absolute outright attack. And these are issues that we should not let stand. So, you know, I would say we should mobilize, we should use the social media, as Tim points out. It's a very good mechanism. And again, I'm not going to be partisan here because I'm not supposed to be, but that kind of thinking should not be acceptable. It is Middle Ages relative to where I thought we had come in the 60s, 70s, 80s. And as a dad with 3 daughters, I cannot believe it. By the way, full reproductive rights services are too far away. So one of the things I am thinking of actually putting into the amendment, I will not be looked on positively because, again, we don't want to hold back good legislation. But it's my opinion that there should not be a woman in the Commonwealth who is further away from full reproductive rights services than a certain number of miles. And if we can't create those services within that, then we ought to be providing transportation assistance. And that is something that should be written into our medical care. Because we have to not only stop the direction that things are going, we have to actually move back in a direction. You know, we used to have those services on Cape Cod. We don't anymore. You know, that's another area where over the last 30 years we've lost a lot. So let's all get, that is part of our job collectively in the room.
So just in closing, I just want to thank you so much for coming today. And I think it's really evident in the exchange that we all need each other, that you need us to provide education and information about what's happening in the community, and we need you in terms of your advocacy on the Hill. You know, I think at the end of the day, I always say this, but at the end of the day, it really always comes down to relationships. And so this forum was really held in terms of trying to, you know, strengthen and maintain a strong relationship with you. So thank you very much.
Well, Kathy, thank you for pulling it together. Thank all of you for coming. I appreciate it.
take them.
June, that's a pretty sweater.
Thank you, thank you, Tim. Listen, I was.
I'll bring these for you.
Thank you.
Chairman of the bidder committee for community services for the possible dreams auction, so I hope you're gonna be on my bid list.